Good morning, Virginia. This is Virginia This Morning.
This Partners in Healthcare segment is sponsored by Health First. Well, resources and information both are main focuses of Health First. For over 30 years, they've been dedicated to providing families with resources to care for a loved one at home. Plenty of these families have questions about new rules and Medicare benefits coming up, but Health First Chairman H. Wayne Sale is here to join us and tell us more. Welcome back. We saw you last year, Wayne, so it's nice to have you back again.
Thank you, Jessica. It's great to be here. Thanks for having me.
It's our pleasure. And we were talking before we were on about how things are always changing with Health First.
It's a state of constant change. The healthcare industry is looking at ways to save money. It's looking at ways to do its job better, take care of people more efficiently, and lower the cost of healthcare. So it's a constant state of change.
Let's remind everybody what Health First is all about.
Health First delivers beds, wheelchairs, oxygen, home therapies to people at home who are chronically ill or who are recovering, and help them recover at home where it's more desirable and more comfortable, and the food's better.
Sometimes. all families have questions about that, and obviously they talk with their doctor about what's the best decision, but if they're able to go home, this can be a real resource.
That's one of the things that Partners in Healthcare brings about, are the many resources available for home care. And there are a lot of needs out there. My particular specialty is medical equipment and supply, and I feel like it contributes heavily to saving our government money from expensive hospitalizations or ER visits.
There's kind of a complicated situation brewing right now that a lot of folks that are receiving Medicare benefits maybe aren't aware of. Tell us a little bit about that.
There's a new payment, a new reimbursement system that our government is putting into place. It'll be effective in our area on January the 1st of 2012, so only about 9 months from now. They'll change the way they pay for beds and wheelchairs and oxygen. The process is called competitive bidding, and suppliers like myself will have to submit a bid to the government to supply the equipment that's ordered by a physician. The premise of it is that it will save money, and I think that's a good thing. I think everyone will agree that's a good thing. However, it's penny wise and pound foolish, because the competitive bidding process eliminates about 90% of the suppliers that are in the marketplace. There are only going to be a few contracts given to the suppliers that win, the low bidders. And while a bidding process works great for government hammers and screwdrivers and commodities such as that, it doesn't work well for a service-based system. If you take the service out of healthcare, you don't have much left. And when you're in the home care business, people need service. They need to know they'll be served, and you can't leave that component out. So I'm very concerned about the long-term effects of competitive bidding, about the fewer number of suppliers that will be there in the face of the rising population of Medicare beneficiaries. There are 7,000 people a day moving into the Medicare field. That's 78 million people over the next 20 years that'll enter and demand the services that we offer. And at the same time, we're reducing the suppliers. So from a common sense standpoint, it just doesn't make sense, and it makes the future look very, very concernable. So to set up a healthcare system that wins the future, we need to change that. And so I would ask your viewers, if you're 65 or over, to help me change the future of competitive bidding in the medical equipment field.
And we have the freedom to do that. They can visit your website. I was on yesterday just learning a little bit more, and obviously more information about this, because it is a complicated topic, and it might be easy for everybody to say, well, what does that have to do with me? Right. But as you look at that larger scale, it impacts everyone.
Right.
So
well, there's a bumper sticker around that I love to see. It says, think globally, act locally. And our viewers need to know that what they're doing in Washington is the big picture, but how it affects them in a year from now is very, very real. So we need to act locally. Most of the people in this region, in your viewing area, are Eric Cantor's, Congressman Eric Cantor's constituents. And the only way we can change this is if he gets a call from them saying, I'm concerned about where we're going, and is this the right way to go?
Well, we'll let everybody know how to get in touch. Thanks for bringing us up to speed this morning, Wayne.
Thanks for having me, and thanks to partners, too.
Absolutely. Get in touch with Health First, one of your partners in healthcare. You can find them at 8143 Staples Mill Road right here in Richmond, or give them a call, 266-2002. And you certainly can always visit online, healthfirstmed.com, and Wayne makes it very easy to contact your congressman about what we just talked about.